And what we actually won in House Bill 2009 and House Bill 2116. House Bill 2009 is 680 pages, and I'm not going to do it justice. But they give me 5 minutes, but I would like to share a little bit. We are all here this evening from diverse backgrounds, diverse communities, diverse political values, because we share a common vision of healthcare justice that ensures health and health care for all Oregonians and all people in our country. Everybody in, nobody out. I don't think anybody does not share that vision. And we have won a significant victory on that road. But it's time for us to just take a minute to reflect on where we've been, because we've got a long way to go in terms of getting to our vision. So I would just like to say that in Oregon, led by Senator Bates, Representative Mitch Greenluck, and a very persistent band of grassroots citizens who were involved from the very beginning, we persisted to get transformative legislation in this last legislature over the last few years. So I want to just say a little bit about what's in that, what we've won, and then some of the things that are not in it that are left to be done. You don't need to take notes, because if you go to the back of the room, there's a little one-page, two-side outline of the things that are in there, because HB 2009 is really a very substantive bill. And I'd like to just highlight a few of the pieces. And as we move forward to what we have to do in Oregon to eventually get to our vision, it's going to continue. We're going to continue to need all of us to be involved. And in Oregon Action, we'll be doing like a teach-in this summer about what's involved in 2009 and where we have to go. So this isn't the last that you're going to have an opportunity, but let me just highlight a few of the key things. First and foremost, as Senator Bates mentioned, we have a health authority. We have a way of streamlining and bringing together all the components of healthcare in our state that'll have the authority and the ability to hold down costs and involve people. It has a health policy board that'll be appointed by the governor, where all of us can be connected to how we design the next steps. It includes a plan for health care for all for our state. It directs a framework of policies and legislation for an insurance exchange. So people have been hearing about that. That's where we have choices in our state about what kinds of health insurance we want. We want to keep our insurance or go into a public plan. It directs the development of an essential benefit package, which means all the pieces of health care that need to be there. So those are all going to be part of it. So we don't have insurance that doesn't cover us, but actually insurance that will cover all the things that we need. It has a all claims database, so that we're basically, when people are submitting the paperwork, it's all going to be similar, so we're not losing we are losing the inefficiencies of the former system. It's going to deal with the workforce, so we're going to need to change who we're training to be part of our healthcare system. It's going to deal with, and this is very important for Oregon Action, there's a plan that deals with healthcare disparities, the differences between race and income and the way that healthcare gets delivered. And that part is addressed in this bill in a strong way, and giving us a way to know what happens with those and how are we going to deal with it. It's going to deal with end-of-life decisions, so that we're going to get some rationality, and I know Senator Bates will talk about that, about how we plan in our own lives and in a way that saves money for our state. We've got cost containment. We're going to be moving to health care for all by 2015. We have legal children, I don't say legal. We have immigrant children included in the bill. But I have to say we haven't, yes, thank you very much. But we have not, there's some things that we need to, that are not in the bill that we need to do. So basically, undocumented citizens are not covered. We wanted to get a stronger rate review process for insurance so that we could really get control of insurance companies' rates as they go up. We know that one of the difficulties is that this is going to take 2 to 4 years to phase in. So that means we have to be vigilant over some period of time to be able to make sure that this goes in a correct way. And they haven't made some of the hard decisions. We haven't made a decision about how employers, an employer mandate, whether that's going to be included or how it's going to be included in the bill. So I just wanted to say one word about House Bill 2116, because it's really amazing that while the other states in our country are really facing a downturn, in Oregon, we've been able to pass a bill that's going to expand dramatically health care for children and add new adults to the Oregon Health Plan, so they're going to be covered. And that there's 13 states that have done it, and Oregon has done it at this time. So that's...
Thank you, Doc Bay.
Yes, because that's the person that was doing the tough negotiations to do that. So that bill basically includes a provider tax for large hospitals and insurance policies, but that money means that we're going to bring $2 billion back to the state of Oregon to cover people, and that money will go back to the hospitals and to lowering our costs too. So it's a tremendous victory for us. So, finally, I wanted to say that Oregon Action will be moving forward with our healthcare committee this fall. We're going to be organized, as I mentioned, we're going to be organizing around healthcare equality and addressing healthcare disparities, and working to make sure that the people that we put on the health policy board need to be people that are representing all of us, that represent the spirit and the vision that went into this. So I was up in Portland, and this is my final thing, last week, where all the groups that have been working for healthcare had met together to look just like we're looking tonight at where we're going. And this is one of the things that we asked the woman who's going to be heading the health authority. Are you going to have that same kind of forums and outreach and committees and participation of the grassroots? And she said, not only is it